So why is it harder to seek a diagnosis for a girl?
Yeah, that's a great question. So ADHD has mainly been studied in boys, and most of the research is in boys, and people are used to ADHD in boys, and they're not really used to it in girls. And so, sometimes even if the signs are there, people don't identify it or they don't recognise it. It's kind of not something they're thinking about. So that's probably the main thing, just not being part of people's awareness, although I think that's improving a bit, more lately. People are starting to think about it quite a lot more, and especially teenage girls thinking about it a lot. I think TikTok and those sorts of things have really helped it take off. And ADHD can present a bit differently in girls. So some girls have exactly the same stuff as boys, they have the whole thing and behaviour issues and everything else, but often girls are kind of quiet and inattentive. They're more likely to have those sorts of things. And so teachers, they're not causing teachers any difficulty sitting somewhere in the classroom and just quietly getting lost. Whereas the boys are often much more active and impulsive and often a bit challenging behaviour-wise. So that's a really big thing. And then I think sometimes girls, apparently masking in girls is more common than it is in boys. So that's, where people try hard to hide or suppress their symptoms. And so they kind of, fit in or get by as best they can. And I think that can contribute a little bit too, so people don't identify it, but then girls are kind of getting by. So I think they're the main things that make it harder. And then you get to a referrer, and GPs might be less, they might be less likely to refer a girl or a Senko or somebody like that. They might just think, oh look, it's not really that bad, they're doing okay. Whereas potentially the person might be doing a lot better if they have it identified and can get supports in and things. Yeah. Makes sense? Your experience?
Yeah.
Yeah. What did you find when you were thinking about it?
I was just confused because when it's just like boys, it's more like anger issues type of thing, and then girls it's like they can't focus and they get really overwhelmed and have like tantrum type of things. Tantrum, like it's not an actual tantrum.
Yeah.
But we get overwhelmed and overstimulated.
More sort of internal distress rather than kind of
sometimes,
getting it out there.
Yeah. And eventually it will just bubbles up and just explodes.
Yeah.
But if girls were to have support with that, I don't think that would happen as much.
Yeah.
And it wouldn't cause problems at school and activities and at home and stuff like that.
Yeah. Yeah. I agree.
Yeah, considering the differences in the ADHD symptoms between boys and girls, is the criteria for seeking a diagnosis through the public system different? Our experience was that Olivia wasn't considered severe enough to be seen through the public system, so we had to go private, whereas our boys were different. So I just wonder whether the public system are catching up in terms of what's happening for our girls.
Yeah.
Yeah.
The criteria are the same, but public systems are pretty overwhelmed.
Yeah.
They've kind of got about a 9-month wait list at the moment. It kind of comes and goes, but it seems to be going in the wrong direction at the moment. And the threshold for accepting people into service is quite high. So you need quite a lot of symptoms. You need 6 out of 9 symptoms of inattention or hyperactivity and impulsivity, and that needs to be across home and school. And it's quite a high bar.
Right.
And
And I wonder if that's...
But inattentive
yeah.
girls, you know, if they have that, they would still be accepted into service for an assessment. But yeah, it is a high bar, and so people with milder ADHD are kind of screened out. But that would be the same for boys as well. Yeah.
I do wonder whether that's why there's the gap with girls with ADHD, because the masking seems to be much higher. So schools don't necessarily see it as much as what parents do. I know in primary school, like her primary school teachers would go, "She may have ADHD," you know, like they'd be so confused by it, even intermediate. Whereas now that we're at high school, it's quite a bit more apparent.
And the impairment from ADHD might be very similar, but often boys have impairment from oppositional defiant disorder or conduct problems or things which really demand somebody do something. Teachers are pretty desperate, and so
they're a lot.
They can add to it. So it's not just ADHD; it's sometimes other conditions that are apparent. And for girls, that might be anxiety or depression. They might have quite a lot of those things as well, and that might be the thing that gets you into service. And then when you're in service, people might look at the ADHD down the track kind of thing. But, I can feel like that though.